Welcome, I'm Maureen Connolly, the editor-in-chief of EverydayHealth.com and the host of Boxed In, a new series from Everyday Health featuring conversations with the country's top mental health experts, focusing on the impact of the COVID-19 pandemic on our mental health and well-being. My guest today is Dr. Brian Fallon. He's a professor of psychiatry at Columbia University, and he's also director of both the Lyme and Tick-borne Diseases Research Center at Columbia University and the Center for the Study of Neuroinflammatory and Somatic Disorders at New York State Psychiatric Institute. And he is also a Castle Connolly top doctor. Lately, Dr. Fallon has been looking at how to help people who are faced with rising anxiety associated with the COVID-19 pandemic. Welcome, Dr. Fallon.
Thank you very much.
How does exposure to stress and trauma affect the brain in both the short and long term?
Well, we have the very familiar fight or flight response, which is a survival mechanism. So when there's a threat in the environment or a threat to our lives, the amygdala, which is the almond-shaped structure in the brain, activates and immediately signals to a portion of the brain called the hypothalamus, which then signals to the sympathetic nervous system to produce epinephrine from the adrenal gland. And that results in an increased heart rate, increased breathing, increased oxygenation, increased blood flow to the muscles, the lungs expand, breathing enhances, and you're able to fight if you need to fight, or you're able to run if you need to run. So that's the stress response. Sometimes we get that response even when there isn't a major threat. So we might perceive something as a major threat when it isn't. And so we're walking around with a high level of epinephrine. We might be hyperventilating. We might be feeling sweaty. We might be feeling lightheaded. And those are all physical symptoms associated with anxiety.
So in the case of COVID-19 and this idea, I feel like there's so much duality, with this pandemic, meaning there are those of us who have become sick and perhaps hospitalized and even maybe lost somebody to this disease, this virus. And then there are those of us who have been sheltering in place for weeks on end now, right? And we're not clear, is there any end in sight? And so when you're dealing with something, in the case of the people who nothing's happening, life is going on as, normal, right? But there's this ever-present sense of fear. How does the brain start to, I don't know, how do we rationalize all this?
I mean, you're exactly right. I mean, people are experiencing this pandemic in very different ways. Those who are on the front lines, the healthcare workers, those who are driving buses, those who are porters in buildings, people, those who have to interact with people where there is a lot of coronavirus infection, are certainly living every day with exposure and fear. Whereas a larger portion of the population who don't have to go to work, who aren't frontline people, they're in their homes, as you say, and they're protecting themselves. So I think with this pandemic, what we saw initially was a massive terror in our world and in our nation, and people were filled with tremendous anxiety, and they didn't know what they were supposed to be doing. But fortunately, over the last month or so, last couple of months, there's been increased understanding of what safety behaviors you can engage in to help protect yourself and help protect others from getting infection. So that has actually, those safety behaviors have been very helpful in reducing the rate of infection in society, reducing the burden on the healthcare system, reducing the death rate, tremendously important. But they've also helped individually, psychologically, giving people a sense of control, that there's something they can do individually that's going to prevent them, or hopefully reduce the risk of getting this infection. So that's been helpful. Another thing is that because they're home, they can choose whether or not they want to pay attention to all of the news out there about this pandemic. So if they're not having to leave their house very much, they're not having to be frontline workers, then those individuals might actually be somewhat oblivious to what is going on in the world because they have chosen not to listen to the media, they've chosen not to pay attention, whereas others might be at home and they might be living listening to the news 3 hours a day, 4 hours a day, all day long. They might have the news on. In those individuals, I suspect their levels of anxiety and depression will be rising because the stories in the media obviously are quite scary.
Right. So I guess, one of the more obvious things to do would be control the amount of media that you're letting yourself look at in any given day, right?
Exactly. I just read an article from that was a study in China where they looked at media exposure, and what they found was that those people who were attending to the media more than 3 hours a day in relationship to the coronavirus epidemic, those individuals were at a much greater risk of having anxiety or depression than those whose media exposure was, let's say, less than an hour a day.
What other habits, negative ones, might contribute to anxiety that people should try to steer clear of?
Well, there's behaviors, there's thoughts, there's feelings. So when you have a feeling of anxiety, what is that feeling like? It's worrying, right? It's like dwelling on the worst possible outcome, perhaps. It's catastrophizing. It's people have what are called dysfunctional thoughts or irrational thoughts. So they think the worst is the most likely thing that's going to happen. They might try to forecast the future and say, okay, society is going to be falling apart in 6 months, and our world is not going to be the way it ever used to be. Or they might discount the negative discount the positive and only focus on the negative. And when that's done, they just get increasingly depressed and anxious. So there's a variety of thought patterns that people engage in when they're anxious that they're not even aware of. So they have a feeling of tension in their body. They have a feeling that their heart is racing. They might feel a little bit dizzy. If you have health anxiety, you might suddenly start to think, oh my gosh, I'm feeling sick. Now, what's the cause of these symptoms? There's an infectious epidemic out there. I'm feeling hot. Maybe I have a fever. I just had a little bit of a cough. Maybe that's a sign of that I'm infected. So certainly in the midst of this epidemic, it's very reasonable to pay attention to your symptoms. And if you do have a cough, if you do have profound fatigue, if you do have a fever, if you do have chills, those indeed might well be signs of coronavirus infection. So in that context, you would want to contact your healthcare provider. But individuals who have just a single sneeze or a clearing of the throat or normal fatigue due to stress, they might misinterpret their symptoms as sign of active infection and then go into this tremendous panic that, oh my God, they're dying.
You also do a lot of work with obsessive compulsive disorder. And I can imagine that someone who, I guess there are varying degrees of it in people who are diagnosed with this, but living through a pandemic when germs are, you're being told every day, here's how to avoid them. What's showing up with the patients that you're dealing with? And then what might the public at large be looking at? Like, could this be a trigger for someone who wasn't previously dealing with OCD?
Well, that's a very good question. I mean, OCD is a very serious and significant anxiety disorder. It's characterized by intrusive thoughts that come into your head over and over again, and you can't get them out of your head. They might occur an hour a day, 3 hours a day, 8 hours a day. And to try to reduce the anxiety associated with those thoughts, you engage in compulsive behaviors. So those compulsive behaviors most commonly would include things like cleaning, washing, to avoid contamination or to avoid infection in the context of normal everyday exposures. But in the context of this epidemic, you can imagine that people with OCD might have an increased risk because they're already engaging in some of these behaviors. So they might be hand washing excessively, and that might have been treated and it might be under control. In that context, now they're being told to do it. They're being told to wash their hands, and they're saying exactly how you're supposed to do it for 20 seconds or more. And you're supposed to be cleaning perhaps your doorknobs and things that come into your house. And so the directions are a little bit unclear as to exactly what you're doing. But if you're highly vigilant and highly cautious, as OCD patients are, they're going to magnify the behaviors and do them more and more. Now, one thing that is, so that is an increased risk, that people with pre-existing OCD that's been under control will have a worsening of their OCD. It's also true that OCD behaviors right now are somewhat adaptive. They're
Mm-hmm.
protective. They're going to protect you significantly from getting this infection, because you're careful, you're vigilant, you're not going to expose yourself to the risk of infection. In fact, you know how to do this because you've been doing it for the last 10 years of your life. This is not new to you. So in some ways, it's comforting to see that everybody else is doing this as well, because it in many ways normalizes your behavior. So in some ways, you feel like you have a whole lot of peers out there doing the same kinds of things
Right.
that you've been doing for a long time. So in a certain way, some OCD patients are finding it comforting. The problem is going to be when we return to society, when we have to let go of these safety behaviors, when we can't be um, hiding or secluding ourselves in our houses, and we actually have to go out. That's when I think a lot of the anxiety is going to return, because individuals no longer will have control. One thing that feeds anxiety is uncertainty.
Mm.
And certainly in this epidemic, we're loaded with uncertainty. We don't have, we don't know when it's going to end. We don't know how we're going to return to work. We don't know exactly when effective treatments are going to be identified. We don't know how accurate the diagnostic tests are. We don't know whether the antibodies that develop after you've been exposed definitely protect you from getting reinfected. So there's so many unknowns that when you have unknowns and uncertainty, people with anxiety predispositions are going to feel a lot worse. So being able to accept is super important when you're dealing with uncertain situations.
Yeah. And so before we talk about some of the coping skills that you'll look into with the study that you're hoping will get underway very soon, talk to us a little bit about your research with Lyme disease and the impact that this has on the brain, and how there might be a correlation between what happens in the brain with someone who has Lyme and trauma, exposure to trauma. I don't know if I have that right, but I think that's.
Well, think about, that's a very interesting question, because when you were asking, I was thinking, well, Lyme disease does indeed have a significant impact on the brain. We know from brain imaging studies that there's decreased blood flow in certain areas. We know that it has a patchy pattern of decreased blood flow, and that is consistent with what you might see with inflammation. We know from some recent PET brain imaging studies that there's signs of inflammation in the brain of patients with chronic symptoms. And certainly we know with COVID-19 that there are marked signs of inflammation all over the body. So on a very extreme level, COVID-19 extends inflammation throughout the body, including the blood vessels in the brain. And that's obviously an area of currently under investigation. And Lyme disease does as well. Now, in terms of post-traumatic reactions, anybody who's had a pre-existing infection is at a greater risk of having psychiatric disorders. Actually, there's been a number of really interesting studies done in Denmark with the entire cohort of the entire Danish population to show that if you've had repeated hospitalizations for infection, you have a much higher rate of depression, anxiety, and suicidal behaviors. So there's a lot known right now about, or a lot of interest and a lot more known about the interaction between the immune system and psychiatric disorders. So given the fact that COVID-19 produces such a profound inflammatory response, it would not at all be surprising that the sequelae of COVID-19 might well be increased rates of depression, anxiety, and psychiatric disorders. We've seen that with other pandemics or epidemics, and certainly it's possible here.
So what do we know in terms of what can help reduce inflammation to the brain? I mean, meditation is a big one, right?
Meditation is important. Exercise is important. Meditation obviously goes back thousands of years. It's an ancient Eastern practices. Um, there's many different types of meditation. There's also different types of yoga. But the practice of mindfulness is very important. Mindfulness refers to focused attention and a non-judgmental focused attention where you're paying attention to the present and living in the present. And that's such an incredibly valuable coping mechanism and things to do, because what happens when people have anxiety is they start thinking about what's going to happen next. They start to anticipate the worst possible consequences. So if you can refocus your attention and pay attention to what's right in front of you, that's enormously valuable. It's wonderful to go for nature walks, for example, and just look at the beauty of nature, look at a flower, look at the sunset. It's beautiful to go for a run, it's a bike ride, and all these things are ways of enhancing your coping skills and focusing your attention on something that's going to make you feel better and be positive for you.
Yeah, so is that what the term radical acceptance?
Yes, that's right. Radical acceptance refers to accepting exactly what is in front of you and accepting the reality of your moment.
So from a very practical point of view, when you talk about these things and they all sound, wonderful, I try and make a point to walk every day. I said, when this started, I have to get out there. And I've kept to it except for one day. I missed my 1 hour walk, and it's been amazingly helpful. If you have, would you advise just pick one thing and stick with it, or try a bunch of things, but do something every day?
Yes, you should definitely do something every day. You should also keep a schedule. So right now, especially since our lives may not be working, we may not, or we may be working, but whatever you're doing, you should keep a schedule and try to maintain it, and certainly incorporate pleasurable things and that reduce your anxiety. And we all have different ways of reducing anxiety. For some people, it might be going for long walks. For others, it might be playing a musical instrument. For another, it might be watching a movie. For others, and many in society right now, it's doing a jigsaw puzzle, because jigsaw puzzles are great because they force you to focus on these tiny little pieces that seem to mean nothing, but you're trying to make some meaning out of these pieces and put it into a larger picture. So it's requiring focused attention at the moment, which is exactly what mindfulness is about, and then appreciating what you've done. And you can see this beautiful image growing and developing. And so it's a wonderful return to an old practice that many in our world right now are doing.
So this is exciting. You just got approval to start a study for people with heightened anxiety related to COVID-19. And I guess the goal is to improve coping skills by reducing anxiety.
Exactly.
Tell us a little bit about this study.
Yeah, and I was, I was quite anxious. All of us were quite anxious at the beginning of this, trying to get our understanding on this. When you see your loved ones sick, when you see your patients sick, uh, it's quite troubling. So, given the extreme anxiety that I was seeing around the world and in my patients, I thought, well, wouldn't it be great if we could share some of what we've learned about illness anxiety, as well as anxiety in general, with the general population? So, in collaboration with Proof Pilot, which is a platform on which you can do online studies, and in collaboration with Journey, which is a meditation app, which is very popular, and in collaboration with national, international experts on Kundalini Yoga, we developed this program in which we're training everybody in anxiety reduction skills using some pretty standard cognitive behavioral training models. And then 2/3 of the people will get additional training in Kundalini Yoga or meditation. And the goal is really to see how well does the anxiety reduction training that we know works in other settings work in the midst of a pandemic? And then if you add on additional skills in meditation or Kundalini Yoga, does that augment the anxiety reduction? So it's a fascinating program. Actually, what's most interesting to me is that we were able to roll it out in 3 to 4 weeks. So that I've never done a study in which from conception to production it's going to be that fast, but I think that reflects the fact that everybody is trying to help others right now as much as they can. So even at the academic research institutions where they have institutional review boards reviewing proposals, they're going as fast as they can to allow their research teams to provide help to the community. And that's obviously the case with all of these wonderful clinical trials going on right now to see what's most helpful against COVID-19, as well as some of these studies looking at stress reduction, anxiety reduction.
Okay, yeah, so this is a great opportunity for somebody. It's an 8-week training program, right?
That's
and,
right.
And open to just about anybody who wants to enroll.
It's open to anybody who has mild to moderate levels of anxiety. It'll be online. You can check. It's at proofpilot.com. That's the platform, and they have a website already set up.
And the commitment time-wise is each day for about roughly how long?
Well, it's 15 minutes if you're of meditation at least. Kundalini yoga is about half an hour of meditation, and the anxiety reduction training is you can do as much or as little as you want, but we encourage people to do a little each day. It's an 8-week program. We do a follow-up at 3 months and then 6 months just to see if the improvement has been sustained. We're really hoping that it will decrease the hyperarousal that is so scary for people, decrease the hypervigilance where they're constantly scanning their environment for harm, improve people's rational skills so they're not living on an irrational level of fear, and in general make them feel happier and better about their life so that they can actually make important decisions for themselves. Because as we all know, our society is suffering, our world is suffering terribly. In addition to there's job losses, there's financial insecurity, there's schools. We don't know when the schools are going to reopen, so parents are having such a hard time trying to decide how they're going to manage. And then there's the horrible situation of people losing their loved ones. So the more that can be done to enhance the emotional health of people right now and the coping skills, the better we will all be.
Yeah, and I imagine the trials for adults, I guess 18 and up, or
18 and up. Yes, this is for adults.
maybe the things that parents are learning, right, they can share with their kids.
Yeah, that's right. I mean, absolutely. That's a wonderful statement, because what the parents learn, they can easily teach their kids in terms of the cognitive approaches, in terms of the meditation, in terms of the stretching that goes along with some of this. All of those can be helpful. But the calmer the parents are, the better the children will be.
This is so true. And I guess, I mean, just to wrap things up, kind of explain to us when you mentioned the hyperarousal, right, and the hypervigilance. I kind of feel like people need to be given a little bit of a pass right now to be told, like, I don't know, for instance, if you're short on patience right now, or you can't seem to focus, those things are like, don't be so hard on yourself. It's actually, you're reacting pretty much the way we would expect, right?
Sure.
Yeah.
And when people are anxious, they're irritable.
Mm-hmm.
And so if you start taking someone else's irritability personally, you're going to feel bad. If instead you say that person's irritable probably because they're scared, or probably because they're upset about something, it may have nothing to do with me, don't personalize it. That's one thing we teach in these lessons, which is not to personalize and to accept and to not judge.
Yeah, I think that kind of thinking is going to come in very handy, not only right now, but when we, as you mentioned earlier, start to kind of reemerge into the real world. I've had people scream at me like when I'm running, just, get out of my way. And here I am, I have my mask on and I'm trying to be, follow all the rules. But I think I try to say to myself, okay, people are just, worried. Don't react. Right. We're all living kind of in this new reality. So
compassion at this time in our society is so important.
Yeah.
To be thinking about other people, what you can do to help other people. That makes you feel better. That makes others feel better. So it's a wonderful thing to do. Some people who, health, just to talk about health anxiety for just another minute. Health anxiety goes on a spectrum from mild to severe. Everybody has a little bit of health anxiety. Those who have very little health anxiety may be somewhat cavalier about the safety behaviors, and because they're not worried about getting infected. They're not worried about themselves. But the point of being compassionate is to realize that you're not doing this for yourself. You're doing it for other people. So even though you don't feel that you need to wear a mask, even though you don't feel that you need to maintain the 6 feet of distance, be compassionate and kind to the other person and maintain that distance.
Yeah, I love that sentiment. And maybe we can come up with a meditation together that you can do right before you're going to leave the house. You know,
Yeah.
breathe in for a minute and kind of go out there with the attitude that you need to, you know,
Right.
compassionate. Well, I want to thank you so much for your time. And for those of you who are watching or listening, you'd like more information, you can go to everydayhealth.com. Thanks again for being here.
Thanks, Maureen.